as far as presenting, I think. So all of this lights and everything, we're good with having a discussion. We have stuff obviously that we want to go over with you guys. There are some handouts if you didn't get one back in the back of the table. Did they move those? Yep, they're over here on this side. And all that comes from what we're going to be going over today. I'm going to show you guys just a little overview to tell you what we're going to be talking about today. We have an hour to go over what we can about signs and symptoms of autism. So there's a lot of information. There will be some overlap. This is not an exhaustive list of everything because there's not time to put all of that, just in an hour. But we're going to try to talk a little bit about just typical child development, what's kind of a typical trajectory for kids, potential concerns developmentally, possible early signs of autism, an explanation of the actual symptoms that we look for, and then information about how we make a diagnosis. If you guys have questions as we go, we will have a question and answer at the end, but feel free to just throw them out and we'll try to answer the best we can. So we'll start with birth to 3, and there, like I said, there'll be some overlap with the ages. You'll see this is not like a perfectly set in stone, everything is gonna line up. There may be differences in kids as well. These are just things that we wanna kind of be thinking about as far as typical development. So for this age group, we kind of broke it down, social and emotional, and then movement and physical. So when we're thinking about the really young, infants, they're starting to develop that social smile. They start to enjoy kind of playing with others, the people they're familiar with, becoming a little more expressive with their face and body. And they may even imitate some movements and expressions of the people that they're around a lot. And like I said, not an exhaustive list. This is just a few things to be looking at. As far as the movement and physical aspect, this is when the babies start to stretch and kick when they're lying on their backs. They might open and shut their hands, bring their hands up to their mouth, and they can usually start to grasp and shake toys. Now, if a child doesn't do this right at 3 months, that doesn't mean you necessarily have to be concerned. There's a lot of factors that go into play. So some kids are going to develop a little bit differently than others.
And then we kind of change with the 4 to 7 month category. We kind of start to look more at adding the cognitive and the language and communication. And as Dr. Cottle said, for different children, different environments, different learning structure, sometimes this, like she said, if it's not within this exact age range, it doesn't mean it's cause for concern. But the social and emotional side, we kind of start seeing that social play or responsive play with other people in their social circle, other parents, family members, responding to expression of emotions and kind of starting to see not just the smile, but the joy behind the smile. For language, kind of seeing that response to your own name, kind of that recognition of this is who I am, being able to kind of respond to no or understanding kind of that boundary, distinguishing emotions or voice tone, and kind of being able to tell when that changes in different people, using their voice to express joy or displeasure, being able to babble, kind of the chains of consonants and different sounds. Cognitive, being able to find objects that are partially hidden, kind of being able to have that exploration mindset starting to form, exploring the environment with their hands or with their mouth, kind of struggling to get objects that are out of reach, kind of that attempt to kind of go outside of their general comfort zone or where they're just sitting in one stationary place. And then the movement and physical, being able to roll front to back or back to front, just showing kind of that range of motion, sitting with or without the support of their hands, kind of being able to hold themselves upright without kind of having that support, being able to reach with just one hand, not having to have both, or being able to transfer objects from one hand to the other without assistance.
And I would say too, when we say here, using voice to express joy and displeasure, obviously we're not talking about your 4-month-old is now suddenly telling you, I feel really happy. This is going to be any kind of vocalization that they might be able to, just a sound that they might make that's going to show you like those consonants, this is maybe how they're feeling.
And then our next, we still kind of have 4 same categories, but kind of transitioning again. Social and emotional, going from kind of that developing shyness and kind of understanding the different feelings between people we know and people that we do not know, or kind of that separation anxiety of my comfort person, my parent, my caregiver has left the room or has left for the day, and I'm staying with someone unfamiliar. Being able to kind of imitate the play of others, being able to kind of copy or mimic things. Sometimes we'll kind of start seeing that preference of certain toys, certain people, certain places in the house. It just kind of depends on the child. With the language, kind of being able to respond to simple verbal requests, or to know kind of when we start hearing some of the sounds or the grunts versus, like she said, not really saying formal sentences, but understanding simple gestures, or being able to head nod or shake our head, being able to say, kind of start seeing those simple words like dada, mama, trying to imitate words that you're saying, even if the structure isn't entirely the way that you said it. Being able to explore things, shaking, banging, throwing, dropping things. We see a lot of that at this age because they kind of get that independence of, I want to try things, trying to find things that appear hidden, or looking for things that they would expect to be there. Being able to look at the correct picture when an image is named, kind of that identification, imitating gestures of other people, sitting or moving to a sitting position without the help, crawling forward on their belly by pulling on their arms or pushing with their legs, being able to pull yourself up and stand without being able to walk without holding on to something, and then standing briefly without support, or may walk a couple steps without support. And kind of like she said on our last slide, I think sometimes around that year mark, if we have a child that hasn't walked without support or hasn't taken off walking, I think sometimes that's when parents kind of reach out to pediatrician of, hey, should I be concerned? And typically it's not they must be walking by the 12-month mark. Sometimes we have some that walk a little bit later, and that's not usually a cause for concern.
Yeah, I think the key is to remember that it's a bigger picture of all the things. So if it's one thing where they're maybe a little bit behind, that may just be a delay that needs to be addressed. It may not be. But you're absolutely right. It's not something that, okay, if you're not doing every one of these things, then now we need to panic. It's not necessarily that way. So now we'll talk a little bit about age 1 to 2. Now we say 1 to age 2, but this could be like through age 2 up to 3. So just to kind of clarify that. So with the social and emotional, this is when we see kids starting to imitate the behavior of others. They start to see themselves as separate from other people and kind of have that awareness. And they may start to enjoy being around other kids. With language and communication, typically, and again, typically, not always, use at least 50 words by the age of 2. And they may put together 2 words to form a short sentence. Things like want drink, go bye-bye, those kinds of things that they might start saying. They start to use action words like jump, directional words like I went down or out or up. The cognitive piece, so they start to sort items by shape and color. You guys probably all had kids in your lives that had little shape sorters. Those are the types of things they would be doing. And then starting to participate in make-believe play. With movement, they usually start to walk without support a little bit more. May start to run, stand on tiptoes, kick a ball. So sometimes we'll have parents that say, well, my child walks on their tiptoes. That could be concerning, or it could be they're in this phase right here where they're just kind of learning that behavior, and so now they're starting to do it more because, oh, I can do this thing aspect. So hopping and standing on one foot for about 5 seconds. Now we don't expect you to count and say, didn't my child walk on one foot for 5 seconds? Just kind of estimating in your mind. Going up and down the stairs without support, being able to kick a ball forward, maybe throw the ball overhand. It might not be great. They might throw it overhand and then go the wrong way, but they're at least starting to learn that skill. Can catch a bounce ball most of the time. Learning to pedal tricycles, climbing on and off of a chair or furniture, and then being able to draw a person with a head and at least one other body part. You've seen all the little circle bodies. My child used to draw the circle with 3 legs and these 2 big eyes. I was like, oh my gosh, what is this? That's totally normal for them to be doing.
So with the age of 4 to 5, this is kind of when we start seeing a lot of our preschool and kindergarten aged kids. This is usually where I think kind of those that are unfamiliar with some of the signs and symptoms or developmental milestones, the school kind of starts guiding and addressing some concerns, or at least rolling out some things for us. But with the social, kind of that desire to please friends and to be like our friends, kind of those mimicking behaviors of, well, they're on at recess and I want to do what they're doing, or everyone's playing tag, I want to play tag, kind of that interest. Even if, kind of like she said with the sports balls, being able to throw a baseball, if they can't throw it as well as everyone else, they at least make that effort or kind of show that interest, even if it's not their favorite thing to do. Being able to develop that imaginative play and not kind of look more at the rigid, we're not really at a castle, we're playing at recess, kind of being able to have that openness to the imagination, being more independent, trying tasks on their own instead of relying on someone else to do all of the tasks for them, using the forward sentences, kind of using the future tense of like, well, when I go to grandma's this weekend, kind of being able to understand what is present and what is coming or what is to come, being able to tell longer stories, even if those stories kind of use broken language, you know, it doesn't have to be the most formal story, but being able to tell a little bit more or tell more about their day, being able to count 10 or more objects, being able to name at least 4 correct colors. Usually about this point, most children will have learned these in preschool or kindergarten, or at least be able to know a few. Knowing items that they use on the daily at home, such as money, food, or even objects they use, like I use my toothbrush, I use my hairbrush, things like that. Being able to stand on one foot for about 10 seconds or longer, just kind of seeing that physical progression. Climbing stairs, alternating feet without requiring support, kind of not having the jumping each stair unless they're like my son that they think that that's funny. Being able to hop, swing, climb, being able to draw a person with at least 3 body parts, and being able to use a fork and spoon, even if it's not perfect, you know, just being able to kind of have that attempt of motion. And then from 6 to 7, still kind of having the cooperating and sharing, even if most kids, that's kind of a struggle of learning how to share or having the desire to share, being able to kind of understand if we are getting jealous of other people or if we are needing more attention, kind of starting to copy the adults in their life, being able to have time that they like to play alone, but being able to balance that time alone is nice, but time with my friends is also going to be equally important. Being able to explain the objects or what that they're used for, being able to read age-appropriate books, or at least being able with help to kind of sound out some words, being able to understand the concept of numbers, why do we count, numbers do have a progression and they do increase as we go forward, knowing our right and left hand, being able to kind of distinguish that directional motion of left from right, being able to copy shapes that are more complex, such as a diamond, or kind of being able to see there are more than just the standard shapes, being able to jump rope, being able to ride a bike, and kind of just practicing skills to become better, kind of that desire of, I may not be the best at basketball, but I can play this at recess and try to at least make a basket, even if it's not, I'm the best basketball player in my class.
And there's so many factors too that, you know, think about the sharing and cooperating. I have an only child, so that was a little bit harder for her when she was younger. Can she do it now? Of course, but those are things too. There are lots of different environmental factors, family factors that can come into play that might make you be concerned, but really it's just they've not had to do that before. Maybe they didn't go to preschool, they don't have any siblings, so they haven't had to share. They just get all the toys. That's how mine was. So those are things to kind of be thinking about as well. Okay. So for the 8 to 9-year-olds, for the social and emotional, this is when they may start to like competition and games and competing with their friends, and I'm going to be the best, and I'm going to win all the times we play Uno or whatever activity. Video games, Uno, I don't like old school, but video games probably these days. They start to play with children of the opposite gender, often around this age, start to become very modest about their bodies. They may not want to change clothes in front of, you know, the parent of the opposite gender, or siblings, that type of thing as well. With language and communication, start using obviously more complex sentences now. being able to explain words and ideas. Again, not perfectly maybe, but they start to do a better job with that. They know how to start and end conversations, and how to kind of summarize a story. So now you're not getting all the parts of whatever, story they're interested in. They can give you a summary of that. The cognitive piece, starting to know things like the date, being able to count backward, naming the months and days of the week in order. And of course, some of that's going to depend on what they've learned, in school, how that's gone. And then the movement and physical start to become a little bit more graceful. Not that they're 100% graceful, but they are able to do things a little bit more gracefully and can do behaviors like jumping and skipping, chasing their friends. And then they start to do more with being able to dress themselves, brush their own hair. Perfect. I don't like their dress, their clothing choices, but they start to do some of those things when they're 11. For the 10 to 12-year-olds, so friendships here are very important. Kids often will say they have a best friend. They may have a big group of friends too, but they have that best friend that they kind of focus on. Start to have an increased interest in the opposite gender, and they start to enjoy talking more to others and having lots of conversations. With the language and communication, they can participate in things like class discussion, and make sense with what they're trying to explain to their peers and the teacher. And they can start to listen and draw conclusions about things that are a little bit higher order for them. Cognitively, starting to write stories, doing a lot better with reading. Does that mean all kids are going to be reading well? No, there could be other factors, learning disorders, things like that, but generally speaking. And then movement and physical may develop skills like painting or sewing or some sort of hobby that they have to do kind of the fine motor skills.
And then kind of as we transition from the preteen to more of the like mid-teen, we start to see kind of the looking more to peers than parents. This is kind of that age where you trust your bestie and you tell them everything versus I'm not telling my parents that. And it's not that lack of trust, it's more just that age development and comfortability. Just seeking acceptance and trust from people that live the same daily life pretty much as you, with going to school and dealing with life obviously as a teenager. Kind of that questioning authority, kind of pushing boundaries or crossing boundaries, family values, kind of that morality of what is acceptable in society and what is not, and where is the line for that. And for each person, obviously that could be different depending on the family values that you grew up with.
I had to have her do this slide because mine's about to be 13 next week, so I figured I'd have too much to say about, she doesn't want to listen to me, and the friends are more important, so it's definitely a thing.
It's kind of that tough age where I feel like at our age, things were a lot different when we were teens versus the teens of today. And so the teens of today, they kind of seek that acceptance when we truly don't know what their day-to-day is like, even though we're there. So it's a little more complicated sometimes for us to be confided in versus their friends. But there's lots of them comparing themselves to other people or having kind of that pressure, because I know it's just concerning, but I feel like there's a lot of pressure at that age. I want to be liked, I want to be accepted. Even if they kind of stand out a little bit, kind of having that want to fit in and want to be accepted by others, and kind of that age of transitioning to, I want to be independent, but I also want approval from the adults in my life. I want to kind of learn some life skills, but also I want somebody there to where if you're teaching me how to do the laundry and I seriously mess it up, you're going to be able to help me fix it. And so just kind of having that approval, but also that support from the adults in their life. Justice and equality are important, developing the ability to use logic, and kind of knowing, kind of like we said in previous slides with different age groups, of knowing when it's okay to be more serious versus more playful and fun, and kind of balancing they're getting older and have to understand the difference, but also having the want to explore the world outside of their community, kind of having the desire to travel, or kind of some of that future planning, even if they never do it, I would like to move to Hawaii and go to school there. Even though some kids that may be a reality, for some they may a year later say, what was I thinking? I'm not going to move that far away from my family. And kind of having, as far as the movement and physical, kind of having the wide range of sexual maturity, having different growth patterns, and obviously teenage years for hormones, everyone is different. but also kind of having the rapid changes all at once of the physical appearance, and that again is at different rates, and kind of having that maturity piece of what is emotional maturity versus the hormonal side.
And our last kind of age category that we're focusing on, since we're focusing more on the childhood aspect, today is up to, we have 15 to 17, but there could be some 18-year-olds in this category as well. So for social and emotional, kids start making commitments. They say, okay, I'm gonna help out with this activity at school, I'm gonna volunteer, and then they know that that's a commitment they've made and they're gonna follow through with that, even though they may not always want to, but they know the importance of that. They start to desire respect. They want people to respect them, the people in their lives, their friends, their teachers, and they wanna have adult leadership roles. So getting involved in an activity, maybe a sport, being a team captain, those kinds of things are really important to this age group. They start to accept and enjoy their own uniqueness, you know? I feel like a lot of kids don't sort of find their people until they're in high school or college, and then they start to like, okay, you know, I might be weird in some ways, but so are other people, just okay. They're still seeking approval from peers, that's still important at this age group. And then the cognitive piece, starting to master more of that abstract thinking, so they can think beyond themselves and things like, well, okay, going to Hawaii sounds great, but that's probably not gonna be reasonable for me, so they can do that type of logic and thinking. Enjoy demonstrating what they've learned, so they're really proud of themselves when they've accomplished something and they wanna show people that. And that they can start to consider other people's perspectives. It's not just about me, and what I'm thinking, how does this person maybe think in the same situation? And then the movement and physical, a lot of concern about body image comes up here. So maybe not necessarily continuing to physically grow, getting taller and things like that, but they're more aware and kind of conscious of the body.
So as far as developmental concerns, these are kind of some things for some of the different age milestones, because we kind of went over what you should expect. This is kind of more the opposite side of what are kind of the concerns. So between the ages of 4 and 8 months, so right before that year category, the refusal to cuddle. Now this doesn't mean that one day they do and one day they don't, and that's a concern, but kind of the complete avoidance, or kind of the sudden discontinuing of I will not cuddle, and then that continues on. Showing no affection for the people that are caring for him or her, doesn't seem to enjoy being around others, and again, that's sometimes with that age group, it's the temperamental or the fussy days, but that is not a continual, and this would be kind of the, I do not want others around me, I don't really care if others are around me. They don't have that joy that we were talking about earlier. If they refuse to respond to sounds around them, or it kind of seems like they tune everything else out. Not smiling spontaneously by 5 months, because that kind of could be a facial concern as well with the physical, or it could be the developmental side as well. Does not actively reach for objects by 6 or 7 months, and again, that's more the effort. If they can but choose not to, that's different. Does not like attracting attention through actions by their 7 months, not kind of doing something kind of to get that reaction of, look, I did it. And then obviously the not babbling or trying to make sounds or words by the time they're about 8 months old. It doesn't have to be that they've spoken multiple words or had formal sentences, but at least the attempt to have some language.
And I think you made a good point too, that everybody has bad days. Even infants, or they have times they don't want to snuggle, they want to scream about everything. So if it's one day here and a day there, that may not be concerning. If it's continuously, like she said, they never want, it's like they don't even care if you're in the room, or giving them any affection or attention, then that's when, you know, we want to maybe think about, well, is there something going on that gives me concern? And then between the ages of 8 and 12 months, so things like not crawling, not being able to stand with support, not searching for objects that are hidden, like while watching. So you try to hide something from them, they're not really searching for where you put it. They may have just seen you do it, but they don't really care about that. Not saying any single words, not learning to use gestures like waving or shaking their heads. A lot of, little kids at this age, they'll wave bye-bye and we'll tell them, wave bye, tell everybody, hello. And then not pointing to objects or pictures.
And then some of the early signs, in addition of kind of what we just read, is the no babbling or cooing by the age of 12 months, not using social gesturing like pointing or waving. I think sometimes at that age, parents will kind of seek help or concern because if their child does not directly point with one finger towards an object, it can be gesturing, it could be kind of looking in that direction, it could be lots of things as far as the gesturing or kind of that initiation of if I look at you and then I look at the object that I want, that is sometimes more of a gesture, and that may be something they do instead of something more formal like pointing. But no single words by 16 months, no spontaneous 2-word phrases by 24 months, and sometimes with this, kind of that spontaneous language is more just it's not prompted, trying to get them to say or practice a formal sentence or a couple words. It's more just they said, like you said earlier, the wondering, being able to say things instead of what feels rehearsed or can you say this. Being able to respond to their name is really important at this age. Now sometimes, if they're like my son, where he is 4, and if I'm like, hey, Brian, come here. If he does not immediately respond, is that a sign of concern? No, because if, like children do, if they have their mind on something, sometimes that's the point when it's gonna take a minute or a couple attempts at their name to get them to respond, and that's typical for that age. But it's something, if it's a refusal to respond, or if you do call their name and it's like they don't recognize their name, that could be more of a concern. Limiting imitation of others, or regression, or we kind of see a plateau of skills, like we were doing some milestones, but all of a sudden we stopped, or we start regressing and doing behaviors that we did years ago, or even months ago.
Is a spectrum, which we're gonna talk about, and it's not just one of these things by itself. If your kid never responds to their name because they really love Roblox and that's all they wanna do, that's different. So just making sure that we're considering all of those pieces instead of just, oh, this one thing happened and now that means I should be concerned, not necessarily. So as far as the actual diagnosis of autism spectrum disorder, one of the keys is that spectrum. It is a continuum. There's people are on that line of, it could be lots of different things, lots of different levels, which we'll talk about a little bit. There's gonna be variability within the diagnostic criteria. So we have criteria we look for, which we'll talk about, but even within that, she might have something that looks very different than I might have within that category. So that's something that we have to consider also. Variability also in people's intellectual and language abilities. So some kids with autism have no problems with language, no problems, intellectually. Other kids have both issues, or one or the other. And then there are some diagnoses that we don't use technically anymore as far as our diagnostic manual and criteria, but you'll still hear a lot of people throw out Asperger's syndrome, pervasive developmental disorder. So those aren't technical diagnoses that we use anymore, but still things that people are familiar with. And when they created this new diagnosis, like diagnostic categories, they sort of put it together. So a couple of things that we're really looking for with the diagnosis. So these 2 areas, deficits in social communication and interaction, which we'll talk about, and then these restricted and repetitive patterns of behavior or interests or activities. So we'll talk a little bit about each of those.
With the social emotional reciprocity, going from kind of what is, and especially we're in Eastern Kentucky, obviously there are times that our language and obviously the professional setting is going to be more formal versus in a more casual setting, kind of understanding what is normal and abnormal social approaches to things, kind of being able to understand social cues or what is normal, or kind of having that response, like if we have to understand kind of when to respond in certain ways, like having a laugh at a time that obviously wasn't the proper time to have a laugh, kind of being able to read the room, failure to have normal back and forth conversation, being able to kind of present information one way, but when there's a response given, not being able to have that continual conversation, not sharing interests, emotions, or affect, being able, kind of that mimicking of, can I read what the other person's facial expression is? Can I respond accordingly? Like if she is looking sad and I'm smiling, being able to kind of match what is around you and kind of understanding why that's important, not just I have to. Being able to kind of that nonverbal communication for the interaction, not being able to use kind of that verbal and nonverbal communication together, because there are times in our conversation that yes, our tone and our words are very important, but also how our body language is, being able to nod or make eye contact with people, you know, kind of that blatant refusal of I'm not going to be able to do those things, or not having, because sometimes people do struggle with eye contact, and that is something that I feel like is pretty common for most people until you work at it. And so kind of having that intentional effort of I would like to make eye contact with you, kind of having that, as well as kind of using hand gestures, like we both said before this, we both talk with our hands, so it's kind of something.
Can't help it.
That's kind of something that's normal, you know, whenever we speak to people, those are normal. If we stood like this and really didn't do much motion, it would look kind of robotic or very concerning. Abnormal eye contact, having really intense eye contact, or really being able to see that it's a struggle to maintain that eye contact with someone. Again, the body language, understanding gestures, like if someone is using more hand gestures or using kind of more of an abstract line of thinking to give an example, not being able to follow that. And then the facial expressions or nonverbal communication, just being able again to read the room or those around them.
I'm glad you mentioned with the eye contact, sometimes really intense eye contact, because a lot of times we think, oh, they don't make eye contact, so that's gonna be it. And that could be, but then there may be kids or adults who are very intensely looking at you, Stephanie, I'm looking at you, sorry, to make my point, and it's awkward, right? So it could be both of those things. So I'm glad you brought that up. It's not just one option. And then the rest for the social communication and interaction, so those deficits in developing and understanding and keeping relationships. So for our kids that we're talking about, and it could be with adults as well, but problems kind of adjusting your behavior to fit the situation. So how do I speak to my teacher versus my best friend? And that may be all the same for a kid when we're diagnosing autism. Trouble with sharing in that imaginative play with other people. Problems making friends, not really understanding, well, how do I make a friend? You know, what does that mean to even be a friend? How do I know somebody's my friend? And then sometimes not having an interest in other kids, not wanting to don't really care if kids are talking to them. And again, there are going to be people who are loners, people who are introverts. That doesn't necessarily mean autism, because we're looking at that spectrum. So that's something to think about as well. Then when we kind of talk about the restrictive and repetitive patterns of behavior and interests, so the stereotyped or repetitive motor movements, that can be use of different objects or speech. So could be hand gestures that somebody uses. It could be lining up things. A lot of kids will line up cars and different toys, stacking with no real purpose. It's not that they are, trying to make something from that. It doesn't really have a purpose that we might see. The echolalia, repeating the last phrases or words that somebody has just said, and sometimes that can be under their breath. You might barely hear it. And then idiosyncratic phrases are kind of odd phrases, odd ways of saying something that you might be able to say with 2 or 3 words, and it might be a really long, drawn-out speech to answer that question. And then the insistence on sameness, being kind of inflexible as far as routines, needing to kind of have those schedules and routines, and getting really distressed if something changes, even a small change. Trouble with transitions. So in school, there may be a kid who has to switch classes, and they really struggle when it's time to go from period 1 to period 2 to period 3, or with the really younger kids, it's time for recess, and then it's really hard for them to come back to sit down and do math. And that could be lots of different reasons, but that may be one thing to be looking for here. patterns of thinking that are rigid, not being able to see other people's perspectives and like, well, it doesn't have to be the way I'm thinking about it. It could be lots of different things. Things like needing to take the same route to go somewhere. Now, that's practical for a lot of things. You know, I take the same route to work every day. But in this case, we're talking about a different way of looking at that. And then eating things like the same food all the time. Again, we all have those quirks. I really like, you know, I joke all the time, I eat like a 5-year-old. Chicken nuggets, french fries, and I'm happy. We all have those things, but we wanna look at that bigger picture and bigger pattern.
And I like that you brought that up, because I think a lot of us, sometimes if we have comfort foods or foods that we refuse to transition from, sometimes people see that as a concern, and you know, a lot of people meal prep for work and want the same thing for that week, and that's not a sign of concern. That's just, this is my comfort, or if it's been a rough day and I want a candy bar, that's a comfort, then that's a comfort, and that's okay. But I think at that age, kind of that peer response or response of those around them of, is this accepted, is this not? And it's perfectly normal. But more on the highly restricted or fixated interests, kind of that abnormal, because all of us have our hobbies, all of us have our interests, but if we have like a severely strong attachment to an unusual object, it's okay to have strong attachments to items that obviously belong to loved ones or are from places that we've been or just are a comfort, but kind of that attachment to something that wouldn't be typical, or the attachment is, I cannot be without it. It's not, I don't want to be without it, it's that I cannot function without it. Kind of that preoccupation with unusual objects, objects that typically wouldn't mean something to other people or other children, are what they are fixated on, and can really struggle with that transition piece to something else or something that other children like, and that is not for them. Kind of that fear or emotional response. Kind of having the hyper or hyporeactivity to sensory input, or unusual interest in sensory aspects of their environment. Usually this is kind of the indifference to pain or temperature, kind of that if everyone else says it's really warm in this room, but they don't really have a preference or give one or make a comment. Kind of that adverse reaction to specific sounds or textures, or kind of the avoidance part of that of, if I know that it's loud in this setting, I'm not going to go. Or specific textures, like I don't like blue jeans, I don't like the texture, I'm not going to wear them. Even if others around them wear them, that's fine, but to them that is a no. Usually the textures, a lot of people think it can be textures of like bedding or clothing, but I think sometimes people forget about like food textures. There are certain people that we all have our food preferences, but there are certain textures that if it has that texture or looks like it might have a certain texture, they are not going to be willing to try that. Kind of the excessive smelling or touching something, not really in a way of touching something a certain amount of times, but kind of excessive touching of how does this feel, how do I feel about this, kind of that excessive observation, or if someone kind of points that out, it's kind of hard to transition from that once they fixated on it. And kind of the visual fascination with lights or movement, and it also could be that avoidance piece of if there are certain lights or certain kind of movement, like certain movies, if they're louder, or concerts with different types of lighting, or different theaters with different types of lighting. Sometimes it will be more of the fixated interest, or the opposite side of kind of the spectrum of I'm just going to avoid it if there's a chance it could be that way.
Alright, so we've given a lot of information, so you guys are probably gonna have some questions. I know we're getting close, we got about 20 minutes, we'll try to save time for that. So how do we make a diagnosis? We're not gonna get into a ton of detail about this, but just a few things to consider. There's not a medical test as far as like a blood test or brain scan that we can do that says, yes, this is autism. There may be scans or tests that can help rule out certain conditions, or help us know if there's a genetic condition that can sort of mimic autism or may have symptoms of autism, but there's not one test that I'm gonna be able to say, oh, they need this test and that's gonna tell us the answer. We of course use specific criteria that we just talked about from the diagnostic manual. We look at the developmental history, all those things we mentioned at the beginning with the milestones. We look at that bigger picture of that. Observation of the person and interacting with them. How are they interacting as far as the social piece? Are they making good eye contact? Is it too much? Are they making facial expressions? All those types of things. Clinical judgment is a big part of it. I wish there was like a hard and fast rule of if it's this many things, then it's absolutely, but we have to use our judgment, and that's why they get a lot of training to be able to take all these factors into consideration. And then we do use standardized assessment measures that look at these different pieces. So we gather information from parents or guardians. We do sometimes IQ tests with kids, do the cognitive piece, and then a lot of play-based and interactive standardized measures as well.
With kind of the next steps of, okay, if I do see concerns in a loved one or in someone that I know, kind of what are my next steps? So obviously talking to a trusted medical professional about concerns that you have about your child, or if you're a caretaker, someone that's in your care. These professionals, they may include like your pediatrician, a child psychiatrist, or another licensed mental health professional such as a clinical social worker like me, or a psychologist like Dr. Cottle. Just kind of, it never hurts to make an appointment and ask questions, or kind of have that rule out of, is this something I should be concerned or not? Because it's always better to kind of have that medical professional stamp of approval of, yes, this is kind of worth being able to discuss versus not being, I guess, comfortable with having that appointment to ask questions. So scheduling an appointment is always good to have an evaluation. If you would like to schedule an initial appointment for a psychological evaluation, UK King's Daughters at our outpatient behavioral office, we do offer this. You do have to have a referral from a medical professional, such as anyone that was listed above, a therapist or counselor, pediatrician, a child psychiatrist if you're seeing someone for medication management. Those are the ways that we can get that referral or schedule that appointment. Seeking information from professional organizations or reputable advocacy networks, because it can always be beneficial to attend different workshops or even informationals like this, just to gain more information and kind of to know if you do have questions, if there are answers, or if we need to refer you to someone else for answers, or kind of just being able, if we don't know the answers to certain questions, being able to kind of figure out the steps for the question or what other questions we would be asking. Some of the groups are like the American Academy of Pediatrics or the American Psychological Association, and obviously attending the remaining sessions that we're gonna offer. I believe we're having 3 more sessions.
We will announce the dates for those soon. But I think they'll be every couple of months, is that right? Back there and back, is that right? So we'll be putting those dates out for people very shortly.
Because obviously in just an hour session, we can't give all the information and our experience with working with autism, but the upcoming sessions are going to kind of break down some of the other areas, such as kind of the interventions or the treatment styles for autism, being able to understand the systems and the services in place that could help following a diagnosis, and also kind of the, if I do have testing for my loved one and that diagnosis is not given, what are my next steps, what are my treatment options, and being able to navigate the challenges of daily living or autism across a lifespan, just kind of having that support and information to where you have a medical professional that understands these steps that you're going through and kind of can go through those with you and offer support as well.
And if you do need to have somebody make a referral to our office, there are some sheets back there at the back as you're going out that have our phone number. We didn't have that on the handouts, but there is one back there that does have it. And then this is just a couple of the resources that we talked about. Not an exhaustive list either. There are so many options. This was just a few that I use a lot and that we've used for presentation. Some local ones like the Kentucky Advisory Council on Autism. I put the Seattle Children's Hospital on there because they have a really good just resource page for patient and family education. I know you're probably not going to pick up and go to Seattle for services, but it's a great option if you wanna just get some information quickly. And then we have just a page with the references of information that we used. And we have saved some time for questions. So, again, it's a lot of information that we threw at you guys. So what kinds of things come to mind if anybody has questions, about any of the material? And if you don't know, we will try to get an answer for you.
I do have a
Yeah.
question. So I seen this on Facebook, is where I seen this being advertised. Will you advertise it again? Cause I'm not in the Kentucky area, so.
Yes, I believe we will do the same, probably advertising. Yes, we'll have it on Facebook. We've had it in the newspaper, some flyers and things, so yeah, it will be on there.
Yeah, so I'm getting this.
Right, yep, it'll be on there.
What I do wanna come to the next session